can you hear me?
Yes.
Great. Good afternoon. My question has to do with the situation in some European countries. We've seen some signs that countries like Italy and Spain may be sensing that they are reaching the peak, and that I believe the UK also mentioned some experts there, or one expert there mentioned that they may be nearing a peak. I'm just wondering if you have any estimates. I know that, Mike, you said on Friday that there's no way to sort of see the end of this, but what about peaking? Do you see any signs of peaking within Europe? Thanks.
If you just look at the the extent of transmission in those three countries you mentioned, they're we wouldn't compare them to Korea or to Japan or to Singapore in terms of their situation. They have much more extensive problems. And then if you compare them to what happened in China, and specifically in Wuhan, which was the most intense epidemic, we did see, rather than basing this on modeling, let's base it on experience, right? We saw what happened in Wuhan after the lockdown, and not only did they do that physical distancing and put people in their homes, but they continued to look for cases. That's the essential difference. They continued to detect cases and isolate all cases, including mild cases, away from their families. But let's assume they've done that. What we saw over a period of days, and I think you were one of the people who asked the question during the Wuhan event, do you think this is stabilizing? Is it going down? And for a number of days, we said, well, we can't tell, and it went up and down and up and down. So what we're likely to see, if you imagine the lockdowns and the stringent measures that were put in place are now in place for between 2 and 3 weeks in Italy at different levels in different places. We should start to see a stabilization because the cases we see today really reflect exposures 2 weeks ago. So the cases you see today are almost like historical, in the same way when we're told that we're looking at galaxies through a telescope, that we're seeing light from 1 billion years ago. We're seeing a reality that existed before. When you count your cases on a daily basis in an epidemic, it reflects a reality of transmission and risk 2 weeks before at least. So in that sense, what we see today is what happened 2 weeks ago. And what we hope to see is those numbers stabilizing, which will reflect the fact that exposure started to drop over time. And some countries, as I said on Friday, have seen that through the number of contacts per case. When they've continued to look for cases, they've still done contact tracing. And what they've found through the physical distancing measures and the stay-at-home orders is the number of significant contacts per case has dropped from the 20s to 15, to 12, to 10, to 8, to 4, which means less people have been exposed to that case than would have been 2 weeks ago, which shows people are distancing. For whatever reason, they're distancing. So there are less people at risk from any individual case. If you get those cases out of the community quickly, they'll expose even less people. And that's how you get ahead of an epidemic. So do we hope that Italy and Spain are nearly there on that? Yes. But the way you stabilize and then move to zero, and I think everyone's talked about the curve up, and everyone talks about the stabilization. The question is, how do you go down? And going down isn't just about a lockdown and let go. To get down from the numbers, not just stabilize, requires a redoubling of public health efforts to push down. It won't go down by itself. It will be pushed down. And that's what we need countries to focus on. What is the strategy now to put in place the public health measures that will push down the virus after those measures may be released? And then how do we take care of people better in a clinical environment to save more lives? So yes, potentially stabilizing, and this is our fervent hope that that is the case. But we have to now push the virus down, and that will not happen by itself.
If I could just add to that, I was going to say, which Mike has just said, is we need to focus on the now. We need to focus on what must be done now to get us out of this. And there is this, I understand completely the desire to want to know when we will reach the peak and when we will start seeing that decline, but that will not happen on its own. These physical distancing measures, these stay-at-home measures, have bought us a little bit of time, a little window of time. And that short window has to be used appropriately so that we get systems in place to look for this virus aggressively through testing, through isolation, through finding contacts, through quarantining those contacts, through caring for further patients, because we will still see patients. And many patients are still going to require need to support other countries that are going to go through this. So the focusing on what we do now is absolutely critical to make sure we use that time wisely, we use that time effectively, so that we do, once we do reach that peak, that we continue to push and suppress that virus down as quickly as possible, but still be ready to find additional cases should they show up. What we've seen in a number of countries in Asia, and that where they've brought this virus down, they've brought transmission down, they're now seeing repeat introductions from outside of their countries. They have not let their guard down. They are still aggressively looking for those cases as they come in and suppressing it so that it doesn't start again. So we need to focus on the now. We need to use our time wisely, and that is to aggressively find this virus and care
One or
for
two
our
more
patients.
questions, so I'll try with Bloomberg and Naomi. Naomi, can you hear us?
Hi, yes, I can. Thanks for taking my question. Wanted to ask, we've seen some different approaches to quarantine in China and in European countries, with group quarantine used to good effect in China. Do you think that home quarantine will be as effective anywhere for people who are positive, or would central quarantine be needed in order to have the same success that China had?
Hi, so we get our terms right and we can explain ourselves properly. We tend to use the word isolation for someone who is a case confirmed. We tend to use the word quarantine for someone who's at risk of being a case, usually a contact. So on that basis, we advise that all suspect cases are tested and all suspect cases are isolated in an appropriate medical facility. I think nobody disagrees with that. Where the capacity exists. When we come to contacts, it very much depends on the context and the intensity of the epidemic at any given moment. In low incidence areas where there are sporadic cases or clusters, we advise that all contacts should be quarantined. Ideally, that quarantine should occur in a place other than the home. And for this reason, one, because if that person gets sick, they may already have infected their family. But that's not always possible. So at least quarantining contacts at home with good health advice about not transmitting disease if they become sick, and with regular monitoring of that individual, is an option for countries. It is difficult to do that in the middle of intense transmission where you might have hundreds of thousands of contacts because you're having thousands of cases a day. It is difficult to deal with that. So home quarantine of contacts is acceptable with appropriate information, education, and more importantly, a very rapid system of getting those people out of their homes if they become sick. I listened to the president of Singapore this morning, and he had a conference call with the Director General, and the clarity of that in Singapore, that ability not only to isolate cases but to rapidly detect illness in the contacts and remove those contacts should they become sick, was a central part of that. And as he said, that wasn't, they're using apps now to do that. They're testing apps, but they didn't do it with apps in Singapore. They did that with community workers, with public health workers, visiting the houses, checking on people, checking their health status every day and saying, how are you? Have you got a fever? Have you got a cough? And if a contact has developed a cough or a fever, they were taken immediately for testing. So yes, we need the information technology tools. They help. They are not the solution. Right now, we don't have an alternative to what we would have considered in the old days boot leather epidemiology. Public health practitioners, doctors, nurses, community workers working with communities to detect cases at community level. And the most likely person to become a case is someone who's been a significant contact of another case. And at the moment, in most parts of the world, due to lockdown, most of the transmission that's actually happening in many countries now is happening in the household, at family level. In some senses, transmission has been taken off the streets and pushed back into family units. Now we need to go and look in families to find those people who may be sick and remove them and isolate them in a safe and dignified manner. So that's what I was saying previously about the transition from movement restrictions and shutdowns and stay-at-home orders can only be made if we have in place the means to be able to detect suspect cases, isolate suspect confirmed cases, track contacts and follow up on the contact health at all times, and then isolate and quarantine, isolate any of those people who become sick themselves.
Thank you.